Dr. Johnny Pete, and I'm here to talk to you today about testosterone therapy in women. Why do women need testosterone, you ask? That's a good question. We're going to answer that today. Specifically, I'm going to talk about bioidentical subcutaneous testosterone pellets from BioTE Medical. Hopefully, you've heard about them, and hopefully you've heard about testosterone therapy in women. It's becoming much more common and much more mainstream. There are many reasons for this. Testosterone helps women in exactly the same way that it helps men. So once you've had children, and once you begin to get into your late 20s, early 30s, testosterone levels begin to decline. A protein called sex hormone binding globulin made from the liver that binds up your testosterone and makes your body unable to use it, those levels begin to increase. So what we see is a decreased testosterone effect in women once they're in their 30s and beyond. And this never comes back again. How is this manifested, or what are the symptoms of low testosterone in women? Anxiety, depression, decreased muscle mass and decreased muscle strength, decreased libido, joint pains, headaches, insomnia. Any of those things sound familiar? Testosterone therapy treats all of those conditions and actually much more. And subcutaneous pellet therapy provides constant dosing that we don't get with other forms of testosterone. Testosterone therapy in women has been difficult for several reasons. Number one, in the past we've used synthetic forms of testosterone that yield more side effects, as your body has to modify these molecules in order to recognize and use them, the modification of which creates metabolites which have side effects and long-term problems. It's also hard to regulate the levels, because levels of testosterone in women need to be much lower than levels of testosterone in men. It's important to note that there is no normal range of testosterone in the bloodstream for women that is known. The American Society of Reproductive Endocrinology has stated themselves that there is no known normal range. So if we are treating the symptoms of low testosterone in women, then we treat to symptom relief, and we do not worry about the actual blood level. In other words, one person may feel better at one level and another may feel better at a higher or lower level. Everyone is individual. We have a range based on our extensive history of pelleting over 1 million women in this country, and we shoot for that range initially, and then we modify going forward based on the patient's response. What percentage of patients get better with testosterone therapy? Well over 90%. And that hasn't been the case in using older forms of testosterone, such as injections or creams. Pellet therapy is far superior with regard to symptom control, and it's also far superior with regard to the side effect profile. Less than 10% of women have side effects of testosterone therapy. Those side effects are usually mild and easily managed. We rarely have people stop testosterone pellet therapy from BioTE because of side effects. I hope that we've answered some of your questions about this. I'm sure that you have many more. One question that people often ask is, can I take testosterone therapy after I've had an estrogen receptor positive breast cancer? The answer to that is absolutely yes. We have plenty of documentation to feel that testosterone is protective of the breast, and in addition, we make sure that the testosterone does not turn into estradiol. So please don't be afraid to treat hormone deficiency symptoms just because you've had a history of breast cancer. We can tailor the treatment to you specifically with your past medical history and your specific risk factors without any problems at all. I would recommend, if you're considering hormone therapy, to purchase this book by Gary Donovitz, the founder of BioTE, and learn a little bit about the product and the method and the science and the vignettes from patients, as this company has helped millions of patients. I hope that you have learned a little bit about testosterone therapy in women, and I hope that you understand that the benefits are broad and are almost in every spectrum of the body, in the mind, the muscles, the bone. Testosterone therapy increases your bone density. It increases muscle tone and density. It helps you sleep, helps anxiety, helps depression, improves libido, strengthens your sexual response. Almost every facet of your body and life will be changed with testosterone therapy. So please give us a call or visit our website, because I'm certain that we can help you, and we would love to care for you here in our office.